Hey guys, welcome back. I have Amanda and Lindsay here with me and Lauren today talking about their fertility journey. I just want to go ahead and put out a disclaimer that this is no way intended to be medical advice. This is their own personal journeys that they are willing to talk about, and listen in for a great episode. All right, guys, welcome back to another episode of the Babbles Nonsense podcast. This is a very special podcast today. We are interviewing Amanda and Lindsay here about their fertility journey that they are going on, and Lauren's here with me to interview them.
Hello, hello.
So we're just going to dive on into it. Hi, guys.
Hey.
How are y'all doing? Are you nervous?
A little bit.
So I asked them before this podcast started if anything was off limits, and they said no. Ask me anything. So that's what we're going to do. We're going to kind of get into the nitty gritty of it. I wanted to let y'all know I'm not very versed in fertility. Obviously, I'm single. I have never really wanted children, but this is an interesting topic for me because I have a lot of friends that are either in their 30s starting that journey, and this seems to be coming up a lot that women aren't talking about. Do y'all find that a lot, that women aren't talking about the issues they're having?
Yes, I think so. I think the thing I notice the most is once I spoke about something, then everyone starts like private messaging, being like, hey, I'm also going through this. So it's definitely taboo, kind of.
Yeah.
I feel like.
I feel like once you talk about it too, like you said, people will start talking more about it more. And then the less we make it taboo, the better it'll get for everyone.
Yeah.
Yeah. So I looked up some statistics about fertility because I wanted to know, because believe it or not, I actually hear this more and more. So I almost don't want to say the statistics because they're actually lower than I thought they would be, just based on my friends that have told me they've struggled. So the statistics as of 2018, 9% of men and 11% of women experience fertility issues. Being a 1/3 of the couples, it was a man issue, and then 1/3 of the couple was a woman issue, and then 1/3 of the couple, it was unknown. They couldn't figure it out. Same statistics in 2022, percentage-wise for men and women having infertility issues, but then they kind of broke it down to a couple because now we're using gender stuff. So 15% of couples were having issues, and then 48.5 million couples globally had issues. I still think that number is very low because how many people are in the world? I should have looked up that. I still think that's low compared to what I've heard and people telling me on their journey. Like working in healthcare and things like that, people are more open to telling you that. So do y'all feel like that statistic's a little low?
There was a study that I can't quote the study, but Dr. Natalie Crawford, who has a podcast as a woman, was talking about how in the general public or population, it's 1 in 8 couples. But there's something that shows that like they specifically looked at female physicians, but if you want to look at like any woman in a high stress job maybe or something, it's more like 1 in 4.
Oh, wow. Okay. And obviously it gets worse as we get older.
Yes.
So we talked earlier about your age, Amanda. You said you're 31 and Lindsay, you're 29. So still, we think very young, right? In today's society, and me and Lauren were talking about this earlier, like back in the day when people were dying at age 60, sure, you needed to have children at 17, 18, 19, 20 years old. But now that we're living till we're 80 or 90 years old, 30's not even middle-aged. So having these issues is a problem, and we need to figure out what's going on. Is it environmental issues? Is it the birth control that our generation was started on? Because we were the ones that were started on birth control at 15 years old. We are that generation. And we were told when we were started on that, oh, this will help your fertility. This will save your eggs. Now they're figuring out that's inaccurate.
Really?
You didn't know that?
No.
Yes. So they would say that, oh, we're going to put you on this birth control because this will actually help you later in life.
Okay.
But we are,
my mind just like blew
we
a
are
little
that
bit.
generation that was started on birth control at 15. I got started on birth control at 15.
I did too.
And I just recently, probably 3 years ago, took out my IUD. I'm not in a relationship, so I'm not worried about the birth control method of it. And my periods still are not regulated from that hormonal birth control. So personally, I think that's what's going on. What do you think, Amanda?
I think it's kind of a weird situation for me. We have unexplained infertility. I never expected to have any issues getting pregnant. I've always had a completely regular period, like down to the like time of the day would start on like a Saturday morning every time. I never had an abnormal like visit at my OBGYN that I went to regularly. I never even missed those. So I didn't expect to have anything ever come up, but we've been doing fertility treatments for over a year now, and I still don't really have anything that they can find wrong with me. So it's hard to say.
When did you guys start trying?
So we started trying in like January of 2020. Okay. So it's been 2 years now.
So I'm not versed, obviously. So how long do you have to be trying without like birth control or any kind of contraceptive method before you can actually see a fertility doctor?
So they always said 6 months if you're over 35 and a year if you're under 35. It seems like they're kind of trying to come away from that now. Obviously, certain doctors hold you to that. But in my specific situation, David and I had not used any sort of contraceptive since we got married in 2017.
Oh, wow. Okay.
So when I say trying, that means like ovulation kit trying.
Actively, yeah.
So I wasn't preventing anything. So once I said that, and we've never even had like a miscarriage or anything since 2017, it made it quite a bit longer actually once I told him that. So,
but what you just said there about having to use an ovulation kit, we think as women there's something wrong with us if we have to do that, because we should be able to get pregnant without that. Did you feel a certain way about having an ovulation kit? Because I know some women are like, I don't care, I'm going to do it, and this one you're going to do it. But then it becomes more of a chore. Like, it's not fun. It's not just spontaneous.
Yeah. So the weird thing for me, again, so none of this really added up. I ovulated and had peak ovulation every month. So obviously my ovulation was not our issue. But
so is it more him?
No.
Are they testing?
He's been tested multiple times. His entire workup's normal too. So we're literally just still.
So you fall into the 33% of unknown category.
We do. And on our first egg retrieval, we've done 3 rounds of frozen embryo transfers. But we have genetically normal embryos too. So everyone's kind of at a loss for what our issue is.
And Lindsay, what about your journey? So when did y'all start trying, or how long did you try before you wanted to go into a fertility specialist?
Yeah, so I was kind of like you. Like, I never really wanted kids, and then I got married, and we waited for a long time because I'm very like career driven and career focused, and so that was my focus. And so after marathon training, I was like, all right, fine, I'll get off birth control. We'll just give this a go. It took my mom a month to get pregnant, so I was like, oh, it won't be that big of a deal. And I remember people telling us like, oh, well, it's taken like 9 years, y'all need to start early. And I was like, no, it'll be fine. So of course we started right after I finished marathon training. So we did a year because that's what's recommended for for your OBGYN. And then once that year hit, I was like, listen, like, we've done the kits, we've done everything, and it's just not happening. Like, we've tried every other day, just the whole, everything they tell you to do. So she's like, all right, well, let's go ahead and, let's start fertility checks. So, they check your blood levels, your AMH, and then they do, I can't ever say this. I call it just the HSG, where they check your tube function, and everything came clear. And then she finally found a fibroid tumor on top of my uterus. And so she was like, well, this is a good excuse to go in surgically and see what's going on, because, insurance will cover it if you have like a reason.
Yeah.
So I went ahead and did that. And so I did come back with endometriosis. That I had no symptoms whatsoever, which a lot of doctors will just not even like go in and look if you don't have any symptoms, but it was there, and it was stage 3 in one spot. So yeah, so she cleaned all that out and everything. And then we kept trying. We got on a few rounds of Clomid, which is just like a stimulator for your ovaries to create multiple follicles. And then now we're just kind of moving towards the IUIs. We've done 1 and we'll do 1 tomorrow. So that's just kind of where we stand. But yeah, we've been unexplained. I even spoke to a doctor one time, and I was like, gun to your head, what is wrong with me? he was like, I don't know. I can't give you an answer.
Have either one of y'all asked the physicians that you've seen, like, are y'all seeing more of this? Is this more in our age group? Like, has any doctor ever given you an explanation of why this is happening more often?
I haven't got an explanation. One thing I wish I brought, there was actually a study like United States infertility versus European infertility, and those numbers were drastically different. And so I think a lot of it, and for me personally, I think a lot of it's environmental.
I do too. I think it's a combination. I think it's environmental. The toxins we're exposed to here, the food we're exposed to here is obviously chemically driven. And then again, the birth control that we were put on that we were told was safe to use. I've done extensive, because I've had a lot of hormone issues just in general from my autoimmune disease with my thyroid. And I've done a lot of research on birth control, and that has had a lot to do with my hormone issues. Now, being 34, still young, had to have synthetic hormone treatment just to even get my estrogen and testosterone and progesterone below or above negative levels. So if I were trying to conceive right now, my doctor told me this wouldn't happen. Because my progesterone and my testosterone and estrogen all zilch.
Wow.
Zilch. That's crazy.
Yeah.
So I mean, it happened. Like I think that it's something that I've talked to many doctors about this. We all need a baseline level starting in our teens and our 20s and our 30s. But insurance is like, you don't need that lab drawn. And I think it is something that would be beneficial, because what if your hormones are already low in your teens? Why don't we just go ahead and start there and fix it there?
Right.
But you mentioned earlier the Clomid. And so there's obviously steps and levels to this fertility journey. Can you explain that?
Yeah, absolutely. So there's a lot of different opinions on like where to start. If you speak to an OBGYN, just like with like fertility background, they're going to be like, all right, 3 months of Clomid, 3 to 6 months of Clomid, and then we'll defer you to a specialist. But if you speak to a fertility specialist, they're like, no, why don't you come on in? We'll start differently. We'll start you on, letrozole or Clomid, and then let's try an IUI. They're going to track things a lot more thoroughly than your OBGYN does. Not saying anything's wrong with that. It's just they see different things every day. And so usually that's like the first thing they give you is Clomid and letrozole, because if you don't know you're not ovulating, for instance, that could fix it. Because for me, like I've never had like a peak ovulation until I've had the trigger shot. Like I've seen it, like the color get darker on those sticks, but I've never had a peak. And so maybe that's it. I mean, I've spent my entire life on birth control. So, I mean, maybe it's just still suppressed. But yeah, so usually they just, try these little things and then they defer you to a specialist, and then you kind of just go from there.
Okay.
My situation was a little different. Obviously, like I said, I had peak ovulation on my own. So like Clomid or letrozole with timed intercourse was never going to be an option for us. They didn't see any benefit to do that because I can produce those numbers and follicles on my own fine. We did do one IUI, which was unsuccessful. Our second IUI got canceled based off like my lab numbers. And then our third IUI, I had some like other medical problems that came up while being on the hormones that have now caused a whole nother set of medical problems over this past year.
Do you care to discuss that, or something you want to leave off the table? Like, so was it a side effect from the medicine?
I don't want to freak people out about this side effect. It's not even listed as a side effect of letrozole, but okay. So I had seizures when I was like 4 till I was 7.
Okay.
But they went away once I was a little bit older. So I hadn't had a seizure for 22 years at this time. And we went to Cancun for New Year's, and I was on letrozole the whole time we were there, planning to do an IUI when we got back. They think it was just like a perfect, terrible storm for me. I was probably dehydrated. I was on the hormones.
And you obviously have a lower threshold for it because you've had them in the past.
I do have a lower threshold for seizures. So this is not to is not to say that this will happen to anyone else. But I had a seizure on the letrozole in Cancun's airport.
Wow.
Because I just have
experience.
If you want to find someone who has terrible luck, just come find me. So that obviously stopped all of our fertility treatments for a while. I had to go see the neurologist and get on seizure medication to be able to go back on fertility medication. Wow. So at that point, we just decided with unexplained infertility, the success rate of IUI is not very promising, and they recommend 3 usually, and we had tried to do 3 but had only like even attempted 1. It just kept not happening. So at that point we decided to move on with IVF. That was just kind of what happened in our journey. So our journey was a little bit different, more sped up, but I think me being medical and my husband being medical, I'm a little bit more aggressive with things. I wasn't just going to, I had an intuition, like I had no reason, like I said, with my cycles and everything being normal, that I didn't have a problem, but I had an intuition always that like something was not going to work out. And people like to say, oh, you're being like an anxious woman, or you're being overreactive, or whatever it is. But there is an issue, right? So you can't cause an issue. And there's been a lot more physicians now coming on Instagram and stuff saying like your lack of positivity, or you're not believing in it. No, they're saying that that's not the cause.
I thought you were about to say they were saying that. I was like, whoa.
No. They're they're finally coming away from that.
Okay,
there's a bunch of female physicians saying like your lack of like positivity in this pregnancy did not cause your miscarriage. It did not cause this like fertility treatment not to work, because everyone wants to give good advice, but a lot of that advice is hurtful.
Yeah.
So to say, you know, it's not God's time, or just worry about it less, things like that.
Stress less.
None of that. Telling anyone to stress less really doesn't make them stress less.
That's what I was going to say. Like saying stress less, well, none of this is working. Obviously, I don't know financially. Does insurance cover any of this?
Ours has been completely out of pocket.
So that's what I was like. So you can't say stress less when you're trying everything you can and your body's not doing what it's supposed to do, right?
Right.
And then you're spending all this money out of pocket that it's also causing. And then you're having to time sex, time that. How the fuck do you stress less?
You don't, right? Yeah. You don't. So that's not helpful.
So saying that is even actually is adding to my stress. Yes. So please shut the fuck up.
I was out of 10 and now I'm out of 12. Thanks. Like, no, I want to punch you.
Well, we were talking about that earlier. So kind of transitioning into that, what the stress and everything. We have this time clock as a woman. We have this. So, and the reason why that is I actually found statistically on a .gov website, thankfully, women in their 30s are half as fertile as when you were in your early 20s. And then after age 35, they said, quote, significantly declines. So there is a time clock. There is a reason why women are like you feel pressured before you hit 35. So being 31, you feel that pressure, which is going to cause more stress. It's going to cause you more anxious because you're like, well, I'm 31. It's not happened yet. So I get it. Like,
and it feels like it's going slow, but like it's been over 2 years for us. And so I'm like, wow, that went really fast. And I'm like, you know, Michael's 34 coming up. I'm 29. And so I get, every time you think about how long you've spent on the journey, it just gets really anxious.
We kind of spoke about the part of like men don't have that.
They don't.
Ceiling.
No, they can have a baby at 80.
They can.
Yeah.
From
absolutely.
Like 14 to 80.
Yeah.
Wow. Cool.
Yeah.
We can probably have them at 14. But that's illegal and no one should do that.
Yeah. I don't know. I find it, as I get older, I find it, there's a lot of psychological, parts to it for women that men don't experience because it isn't on them, right? Like in that respect, it isn't. I mean, it could be like if men have issues.
Going off of that, think about back in the 1800s when you were the king and queen and you were supposed to you were supposed to bread, whatever.
Bear. You're supposed to bear.
Bear the air.
And it was the woman's fault, but actually it's the man. Right? Like, so.
But I'm just saying, like, back in the day, like, they would, like, behead their wives.
100%. Yeah.
Or be like, fuck you, I'm getting another wife.
Yeah. Or a couple.
Sorry, I just took your train of thought. But
no. But I mean, there's a lot of, like, that side of it that we don't speak about, I think, too. And so it drives us into that hole of, well, I can't say anything because what if I'm being wrong about it? What if my feelings, what if I'm being too selfish or too, you know, whatever, hormonal, sensitive, right? All the things that we get called. But it's like, but no one's talking about, well, hold on, let's look at the entire picture, Like, yeah, it is really big to us. Like, that's not all women. A lot of women want to have families. But men, they can literally have a family just about anytime they want.
Well, we have 3 different types of situations here. There's 4 of us here. Y'all two, Lindsay and Amanda, are on their fertility journey. Lauren has had children. I don't want children. We're all, well, you're not in your 30s yet, but you're almost there. We're basically mostly in our 30s, and we're on different journeys of our lives, right? I hope this is not insensitive, but Lauren, was it hard for you to have children?
My journey definitely was not smooth. I have a son and a daughter, 10 and 5. And I had my son when I was 24. And I had 2 miscarriages before having him. And like, right, no one talks about it. I can remember my mother-in-law, they had like both my husband and his brother, they were, they call them Vanderbilt babies, because they tried for 10 years and they couldn't conceive naturally. And I remember being in the car and like legit, the only like comfort that I got from anyone was her being like, I had a miscarriage once. And that was it.
She understood.
But I'm talking like everyone that I spoke to.
Yeah.
Like it's not something that like we talked about it. And so back in the day of blogs, I blogged about it. Sorry. Okay. When my son turned 1, I could talk about it. And so I decided to write about it. And I had so many women reach out to me personally, and like either they were going through it, they had gone through it, they were having issues, and like people that I'm not really friends with would like reach out, and like I would do like my part, because you don't know that boundary either of like, I don't want to step over and make you uncomfortable or whatever, but it's like I would try to be there for them or answer any questions, but I'm just like, holy shit, like why isn't there like
more talk?
More, yes. Yeah. And this is not something that's like
new.
Yeah.
Well, that's why, I mean, Amanda and Lindsay, y'all started a fertility group on Instagram. What's that called?
The Infertility Support Group of Huntsville.
How has the outreach been since you've started that?
I thought it was really good. I thought we've had a lot more than I expected. A lot of people just from wherever have like messaged us, reached out, and even friends who didn't have fertility issues at all, like have been so supportive of it as well. And so we had our first kind of sync up last week at Honest Coffee. Oh, wow. And it was really great. It was I thought it was very therapeutic just to like,
well, I mean, it's not, it gives you comfort in knowing that you're not alone in your journey.
Absolutely. Yeah.
And like, so I've told y'all that I had hormone issues, and I say that I don't want children. It's mostly because I've helped raise 12 nieces and nephews. So I feel like I've done it already. Right. So, and I'm not saying that if I meet the man of my dreams tomorrow, that I won't want to have his babies. But when I was told by my doctor, single female, told by my doctor that if I were to want to have children, I couldn't. And then that opportunity was taken away from me, even though I had already made up the decision that I didn't want them. I was like, wait a minute, you can't take that option off the table if I haven't made that decision.
Right.
So I can empathize, even though I don't obviously know what it's like to go through the journey, but I can empathize with it. And I don't, if this is too personal, just, again, I get in there. So just tell me no. But like when it comes to money, we were talking about this earlier. So obviously if you have a good job and you can afford it, you can go through infertility. So what does that say for the people who are having fertility issues who make less than $30,000 a year?
They have no options. You know
what I'm saying?
So I mean, even if you make quite a bit more than $30,000 a year, I have a good job.
Because it's expensive. I've heard it's really expensive.
I make, good money, but I would not be able to pay for this out of pocket if, say, I were a single woman who wanted to, get a sperm donor or something I could probably do IUI with that route and pay for it. But if I were to have to pay IVF out of pocket by myself, I would not be able to do it.
And that's something I think that maybe your group I don't know, can maybe lobby. I don't know how you do this. I just thought of it in my head. How do we lobby to get insurance to pay for this? Because this is a medical problem that actually the government caused.
So a lot of states do require insurance companies to pay.
Oh, okay. So Alabama is just not one of them?
Of course not.
Of course.
Yeah, Maryland, some of Georgia, and then some of Colorado, I think, require it. So
how do we get that? How can we
I
help?
think California pays quite a bit too.
I would hope so. They pay a lot of taxes.
Yeah.
I was just saying, like, how can we, like anyone listening as advocates for this cause, help lobby for that? Is there something that we can do? Like, is there something that we can petition Alabama government to do?
I think we'd have to find someone who knows more about that process. I don't personally know how to go about that. It's all so overwhelming.
Yeah.
There's lots of days where I feel like I can't even, like, outside of work and dealing with this and, like, you know, my relationship, I don't have anything else left.
Yes.
It's a lot.
The energy is gone. Well, maybe we can look that up for you, or maybe if anyone's listening, they may know and can reach out, and then we could try to figure that out, because I think that would get some of the stress off, because then it's not so much of a financial burden, I think.
And I think too, like, just lobbying with your local senator for Alabama, I think we have a really, like, aside from politics, we do have a really good opportunity coming up. A very young female is running for senator, Katie Britt.
Okay.
I don't know her background. I don't know anything, you know, from that perspective, but having that opportunity here in Alabama, which is pretty rare for us, could be a point to maybe contact her and, you know, just set up that meeting, because, I mean, that's her job, is to speak for the people of Alabama.
Agreed. You mentioned something a minute ago that I didn't even think about till you said it, the strain on your relationship. What is this like causing into your relationship? Does it make it harder?
So David and I have actually been really lucky throughout this. I talked to a lot of people who have had a significant strain on their relationship. We're both pretty open people. He's a very, like, comforting person. So I more so than him, like, I don't hold anything in. If I hold things in, it gets too much and it'll blow up. So he pretty much overly knows all of my feelings. But I, you know, like we talked about timed intercourse. Obviously, that's not very attractive or sexy. Like, no one's really into that.
Yeah.
I do have to say, the one thing IVF did help with, you don't have to do that. You're no longer having sex to get pregnant, because you're past that.
You're having sex to have fun again.
You do. Like, they put you on birth control. I mean, not that I'd even get pregnant without the birth control, but they regulate your cycle. You do have some, like, rules, like when you're stimulating for egg retrieval, you can't have sex and stuff, but it is a lot on your relationship, and it, like, a lot of it's financial. If women are always on hormones, we're all probably a little bit crazy.
I was gonna say, what does that do to your body?
That's what I want to know.
Because I'm sure there's weight gain involved.
Yes.
Yeah.
And your psyche is fucked
mental
with.
health already, you know, no one was talking about it either.
Yeah.
But if you already have mental health, like, struggles at baseline, these, like, last summer they put me through menopause essentially with my medications for IVF.
Wow.
So I was going through menopause basically at 30 from medications.
Well, just so you know, that's where my hormone levels are.
Twins.
I can empathize with you there and sympathize, because I've been there. It's not fun.
Gained I will never know how much it was, because I refuse to weigh, but I gained at least, you know, probably 25 to 30 pounds on those medications, putting me through menopause. I felt like I was dying half the time. And, you know, I probably wasn't in the best mood. So I'm sure I'm super fun to be around.
I think that was the hardest for me, was the hormones, because before we even went on this journey, you know, I'm a big marathon trainer. I work out all the time. But when we started the hormones, I mean, running was so hard for me. It's still hard for me. I mean, I'm getting a little better, but everything was so hard. I gained at least 25 pounds. And it's just like, you're hungry all the time, and it's not your fault. And then emotionally, it's like
a roller coaster.
Yeah. And you wake up and take a negative pregnancy test. You got to go to work. You got to start the whole cycle over again, baseline ultrasounds, blood work. And it's just exhausting. And so I think mentally it is so hard. So finding that, like, thing that will help you, whether it's like reading, going on walks, running, is just so important during this journey.
And I'm assuming that y'all have never had pregnancies at all, like no miscarriages, nothing.
No, nothing.
So I don't want this to sound, and I keep saying insensitive because anyone can take what I say and run with it. But have y'all watched The Handmaid's Tale?
Yes.
I have. When I started watching it, obviously it's quote unquote fake. But when you look around us, do y'all not see a semblance of what that's about and how they
got there?
And like now they can't get pregnant except a certain few, and now those are the handmaids. Like I don't know. It's just kind of like eerie to think about. But is that the world we're heading into? Because it kind of seems like it. It kind of seems like more and more and more. And probably after this podcast drops, people are going to say, "Hey, I've had fertility issues and I didn't want to tell nobody." Because you don't want to tell anybody. You don't want to tell anybody because then there's something wrong with you. If you speak it into fruition, something is it's real. Something is wrong once you say it.
Yeah.
Right.
It makes other people uncomfortable too. So then like something I never expected to have to like deal with this was other people's feelings towards me going through it.
About the thing that you're having to deal with.
Yeah. So there has been a lot of that. Other people, I don't even know how to say it, like explain it, but like other people's feelings about your infertility.
I can remember after I had to have, I think it was after the first miscarriage, I had to have a DNC. And I can remember being like, I don't want anyone around me. Like, I'm a very private person. I don't want anyone around me. And I had a family member get upset with me because I wouldn't let anyone come to the house. And I like,
it's your procedure.
Yeah. And it was just like, wait a second. Are we like, is this really happening? Is this really happening? Like, I'm going through like literally the worst time of my life. And I have to worry about your feelings about like, you know.
And then it puts another stress on you.
Yeah. And they make it about them. And it's like, oh, I don't know. It's just frustrating.
Goes also back to what you said earlier, Lauren. Before y'all got here, we were talking about what we were going to speak about and the whole time clock and people, because I get this a lot. Do y'all get people saying, "Oh, when are y'all going to have children?"
Oh, yeah.
Yeah. So let's talk about that a little bit. So if anyone's listening and you don't have children or you don't have fertility issues, but maybe reword it. So Lauren, you had said that you had started in your mind rewording how you ask people.
So after like I went through my stuff, and so I never finished this, but after my no, you didn't stop it. It was just the conversation went somewhere else. It took me 2 years to get pregnant with my daughter, and I never went in to have anything checked or anything. It's more intuition. You talked about like at the beginning, like you felt like something was going to be wrong or a struggle or whatever. It was just something that I knew, and you can't explain it. You can't put your finger on it. It's just like, I knew when I got pregnant the first time, I knew something was wrong. Yeah. And I went into my doctor and she's like, no. And we did ultrasounds and the heartbeat and the heartbeat and the heartbeat. And then one day there wasn't a heartbeat. And so it's like, I think there's just things that we know we can't explain, but if someone doesn't have that same feeling or side, or if they've experienced it, then they shut that down for you. I don't know where I was going. Oh, okay. Yeah. It was, so, you know,
instead of saying, when are you going to get pregnant?
When are you having kids?
To a couple, like if like even family members, like they don't mean any harm by it, but if we could all just change our verbiage
into, do you want to have kids? And I think that helps open the conversation of, yes, we do. And then it's up to you if you want to share we're trying or we're not. Because when people ask, when are you having kids? It's this expectation. And it's like, it's almost like them taking it away from you without them understanding. And that's a really hard conversation to have.
Well, because I get it a lot being a single, like patients, because we're in healthcare, like patients will be like, why don't you have children? You're 34. And I'm like, well, I'm single. So, okay. Like,
they decide for you.
Or so once you, obviously I've never told my patients about our fertility journey,
but maybe you should, and I don't mean this in a rude way, maybe you should. Maybe you should be like, you know what? I've done 3 rounds of IVF. Why don't you shut the fuck up? And they'll be like, oh, damn.
I'm almost there. You know, this is about to be my 4th round. And like, once you throw me back on those hormones, like some people might be hearing that that response to them. I felt like my distant family specifically, David and I will be married 5 years this year. We have always said we wanted children. I feel like at a certain point you should maybe just assume that there's probably an
something
issue
going on.
Like we have a house now, we both have our jobs. Like maybe the reason we don't have children yet is because we're having a struggle.
Or maybe reach out to a family member if you know that, kind of like your situation, and go, is there anything I can do for you? Because they have to, like you said, they have to know.
Right. Because we had always been very vocal that we wanted kids. You know, it was kind of dumb at the time. Before I turned 30, we started trying like a little like ovulation stick trying when I was like 29. But I'd always been like, oh, I want to have a kid once I turn 30. I know plenty of people that said that, came off their birth control at 30 and they have kids now. That works for some people. Didn't work for me, but...
Again, I came off my birth control. My hormones are still menopausal level because I refuse to go on hormones because what's the point? I'm single.
And they'll make you feel like trash.
Well, and I'm also scared of like the side effects, blood clots, breast cancer. People don't talk about that. Like, and it's so fucking insane that the women have to go through all this. What is your husband going through other than listening to you bitch?
Right. I was like, if he could do this and carry the baby, that'd be fine. We can try this as many times as you want. But
you know they're talking about men's birth control now.
They should.
But what they're saying now is, will men even take this
Probably
if they
not,
know
they
that
don't
they're
get
going to be
pregnant.
shooting blanks? No. Just like men don't want to have vasectomies because they're like, well, that won't be my sperm. Well, fucking so what?
Well, it doesn't affect them as much, right? Like they don't get pregnant or not get pregnant. Like,
But they also don't do a lot of studies on women because of our hormones.
right.
So like any study that you ever, like anything, not even just fertility, any study, exercise, diet, they only do on men.
Yeah.
Because it fucks with women's hormones. So they refuse to do studies on women.
Because
then it would skew their study.
There was also a study like recently, I can't quote the study, but from the time of patients presenting with symptoms of endometriosis, it typically takes 7 years for a diagnosis.
Yeah, that's been a huge thing. Like doctors are ignoring individuals with endometriosis symptoms and like just kind of writing it off. And that's a huge trend I'm seeing in the infertility world.
Now that you say that, and I'm sure my aunt will not care that I'm sharing this. She's my great aunt, so she is older. I'm not going to say her age or she will kill me. But she just recently started having vaginal bleeding post-menopausal age. And obviously, if you're in the healthcare world, that's scary
Not
because
good.
it means usually endometrial cancer or uterine cancer. So ladies, if you're having postmenopausal vaginal bleeding, definitely go to the gyno. So she went. She wasn't concerned about it, but I was like freaking out when she told me on Thanksgiving. I was like, you need to go to the doctor. She was like, it's probably just my uterine fibroids. I've had uterine fibroids before. So she went and she did have uterine fibroids, and they did a biopsy, and it came back like this could turn into it's 54% that this could be cancer. So they went in to do a full hysterectomy because she didn't need anything. And they went to do that, and it was supposed to be a laparoscopic procedure, turned into an open belly procedure because she had extensive endometriosis, had all this other stuff in there. But on that note, she had tried multiple times to have children with my uncle and had, I think, 8 miscarriages and 1 stillborn. And so she quit trying after the stillborn. But I was like, me and her talked about this. I was like, do you think that could, because she's older, so they didn't, there was no fertility specialist that you went to. It just was what it was.
They definitely thought you were crazy back then.
Yeah, like it was just, I was like, do you think this endometriosis that has now expanded past your uterus into your abdominal cavity is causing?
Absolutely.
She was like, it probably did.
It did.
It probably did. But it wasn't talked about.
No.
Exactly. And a lot of doctors, I mean, they do just write it off. I mean, I was very thankful. I had, a great OB here who was immediately like, let's go check for this. If I'm able to clean this off, I will, but I read online. I was like, oh, you guys are so lucky. I'm on a 3-year wait list to have that surgery. Or, and overseas, it's a lot more difficult to get it and have people listen to you. And so I'm just like, wow, I'm so thankful. Like,
And like you said, you had no symptoms.
I had 0 symptoms.
So
like most women have symptoms. Like most women are like,
have painful periods.
Yes.
Heavy bleeding.
Yeah. I had nothing. And she was like, you have stage 3 on this ligament. So it's like, yeah, it's hard for people nowadays, I think, just to get the surgery or just be listened to.
I've asked to have like the surgery to go look for endometriosis.
Just like a laparoscopic
Yeah, I've
procedure.
asked like 2 or 3 different doctors, and no one still wants to do it. They've said pretty much that they're not seeing a huge benefit even, and they'll just treat it with the medication. So that's what I'll be doing again next time. So to treat endometriosis, they put you on Lupron, which is what puts you into menopause. It kind of suppresses like any estrogen, I think. I think they can treat like some like estrogen driven cancers with it too. So these are not drugs that have no side effects like you were saying. And it's like, how many times am I supposed to torture myself basically, like mentally, physically, to try to figure something out?
And Amanda, you said you're about to be on your fourth IVF. Mm-hmm. How many IVFs are you allowed, or is it indefinite, or that you're going to put yourself through? So
for me, I've never been told I like have to stop at a certain number. We've done 3 transfers with not even a chemical pregnancy, even though we've had, genetically normal embryos. Right now, our plan, my egg retrieval will be hopefully March 13th for my second egg retrieval. I still have 2 genetically normal embryos from my last retrieval, but we need to get more, obviously. I thought 5 to start with was going to be plenty, but it has not been. My new doctor is in Denver, Colorado, so I'll go out there next Friday. They'll monitor me every day up till the 13th. Hopefully we'll do the egg retrieval on the 13th. After that, they'll send off all of the blastocysts that make it far enough to be genetically tested. We'll do that. Once that comes back, we'll start Lupron. Lupron's given, in my situation at least this time, I do 1 injection, and then 28 days later I do another injection, and then after that we can get ready for a transfer. We'll have to see how this one goes. Honestly, I did my second and third transfers back to back last July and August. That was not the best idea for me, mentally or physically. I really should have been told to stop. We'll have to see how this next one goes. I'm definitely willing to do.
I was going to say, is that your first one with
my new doctor?
Okay, so this will be your first one. Okay,
yes.
Okay.
And so I'm definitely willing to do a 4th one. Kind of up in the air about a 5th one. We'll have to see how it goes and what the doctor says out there. I think our next step just for us will be to get a gestational carrier. Since we will have our own embryos. So we'll probably get a surrogate at that point if we don't have any success. So
now, when you say not success, so going back, let me just define this for people who don't know. So what I found was OI, ovulation induction. Is that the Clomid, where they're just stimulating the follicles?
Yes.
Okay. And then there's IUI is the next step after Clomid, which is intrauterine insemination, which is an in-office procedure. A catheter is placed the sperm into the uterus,
and they wash the sperm so they get only the best ones.
Okay. Yeah. And then IVF is the last step that you can do, and it's where it's in vitro fertilization, where the ovarian stimulation is done with the meds, and then the sperm and the egg are collected and combined for fertilization, which is your embryo.
Yes.
And then it's transferred into your uterus.
Yes, but there's different types of IVF.
Oh, okay. Didn't find that in my research.
This is not medical advice that I'm about to say.
Nobody listens to us.
So this is just personal experience advice. So there's different types of IVF. They can do fresh transfers. They can also do frozen embryo transfers. Fresh transfers, you'll have an egg retrieval done, and typically 5 days after, I think, they'll go ahead and put a day 5 blastocyst, and they'll transfer that into your uterus. I've never done one of those. It seems like less and less clinics do those because you can't do genetic testing for fresh transfers. With IVF, standard IVF, they more so just put an egg and then sperm in like a petri dish and let them fertilize like that. That's what we did last time. And then they grow them to a certain day, and then they can biopsy the ones that are appropriate, send those off for genetic testing. The type we're doing this time is called IVF with ICSI. Don't ask me to tell you what ICSI stands for. But basically they get the sperm and they pick out the best sperm and they inject it directly into the egg instead of letting them sit in a dish and fertilize themselves. So it's a much more direct.
Yeah.
And they seem to have better success rates in our like more difficult situation with that, even though we don't have a sperm problem.
So when I was asking you, so you said that your embryos were fine. So that means they grew a baby?
Yeah.
So then what happened after, like, so they put
just
them,
never stuck. I have no implantation.
So they put them in your uterus and they didn't
take.
Okay.
Yeah.
Okay. Did they, and so no one's ever went in laparoscopically to figure out why?
Nope.
Wow.
Yeah. Our specific issue seems to be with implantation only.
Because something in your uterus lining. So it could literally be an easy fix of clean out my uterus lining.
Yes. But the medicine, I've never been treated for this long for endometriosis. I was only treated for 18 days last time, and I'll be treated for 60 days this time. And then when they've done their trials, this is like a much more effective treatment for that amount of time. Yeah.
Okay. Interesting. That is very interesting. Wow.
There's a lot that goes into.
There is more than I knew.
Yeah.
Which I knew was more complex than what people talk about, because obviously. So I actually had a friend that did, I think, 2 babies that they had IVF because she was told she could never get pregnant. They quit trying, had a 3rd baby on their own, like their miracle baby.
Yeah.
So I was just like, wow. And no one can explain it. No one can explain like why she was having all these issues with the 2 and then all of a sudden had a baby. It's just mind boggling.
Yeah.
Now, and again, if this is too sensitive, please ignore me. So if this doesn't work, long term, would adoption be on the table?
For us, since we are going to hopefully have a lot more embryos, we'll probably go the surrogate route.
I didn't even think about the surrogate route.
At least the first time, just because we have our embryos. If we didn't have embryos, then yes, neither one of us are like opposed to adoption at all. But I think our first route will be surrogacy.
And that's another conversation in itself that I need to get someone on here about adoption, because how hard it fucking is to adopt children when there are so many children that need to be adopted.
Right?
Yeah.
Like just...
And for us, adoption is definitely on the table for us. I don't know personally if I can handle full IVF. I'm just not really ready for that. I've talked to the new doctor I'm going to about mini IVF, which is like a whole nother process. So it's just low.
Can you explain that?
Absolutely.
What's mini IVF?
So they call it InvoCell. Is that right? Something like that. So what it is I wouldn't be on any more medications than I am for an IUI. And they go in and you only get maybe 3 or 4 eggs if you're lucky. And then they put it in all 4 eggs in this little like tampon looking thing, and they let it fertilize, and they like stick it up inside you for 5 days. Cause I guess you are like super warm inside. And then they take it out, and like they see what they got, and then they just transfer right after. So yeah, it's just a lot less medication. And so for me, I really have a hard time on all these hormones, and physically, mentally, it's very difficult for me.
I can imagine. I mean,
So if that didn't work, so after this second IUI that we'll have tomorrow, if that doesn't work, we'll possibly move to mini IVF if I feel up for it. But if not, adoption's definitely on the table for us, for our situation.
Amanda, you said something earlier, and I was sitting here thinking about it in my head, and now I can't remember. Damn it. It'll come back to me. So you said that you shouldn't have done your 2nd and 3rd
back to back
IVF back to back. In your personal opinion, we're not saying any names, where it was done, whatever. Do you feel like that was more money driven from the physician side, pushing you to do that, or do you think that's a common thing to do, or
I think that it's both, probably. And I think when you're at this point, you're so desperate for something to work, and when people keep offering you treatments that should work, you're like, okay, I'll do it. I'll keep doing it. But I think I wish at the beginning I would have had more than one opinion. I think it's important to see 2 doctors and at least have 2 opinions. Probably before you start even IUI, maybe definitely before you do IVF, I think you should have a second opinion. I mentally and physically was not myself, and putting me on more and more and more drugs over and over again, I think that they should have probably assessed me as an entire person.
I was going to say, they probably should have some kind of mental health.
Yeah, there should be more guidance there.
Yeah.
I do have to say my new clinic in Denver does that.
Okay.
They have therapists in-house. They have
wow, good.
all their geneticists are in-house.
Because I was about to say, at my clinic where I work now, before anyone can get a spinal cord stimulator, they have to go through a neuropsychiatric evaluation before they can even have it.
There should be more of a mental health evaluation prior to this. And I think you should be checked in with that more often than was done at my last place.
Because depression comes into that.
Well, okay.
Right?
And this is really important. And this is something that people don't always realize is it doesn't stop at getting pregnant.
No. especially not with these types of pregnancies. They're much more high risk. There's many more issues.
Well, you might have more postpartum depression because you're already having anxiety and depression getting pregnant.
Prepartum.
Well, and
So look, why would that not extend over?
There's trauma there. I mean, and like our bodies hold it, and it's almost like this happened to you, but like life keeps going and moving, and you're like, wait a second, like I need to catch my breath from what just happened. But like when y'all do have families, because
you will,
I'm putting that juju out there.
First of all, I was told by a psychic that I could manifest whatever the fuck I wanted because of my astrology signs. He said I could either manifest it for good or bad. So you're going to do good tomorrow, and you're going to do good at your next appointment.
Yeah, thank you. Thank you.
But it doesn't, like, when you do have families, that's a whole other struggle. And that's something that also doesn't get talked about is you go from one thing to another, and it looks different, but there's always struggles there. And so it's not, I think a lot of
the journey doesn't end here.
Yes. Well, it's like, I think a lot of people, if I can just get there, if I could just get there, if I could just get there, but then there's no thought past that. And then like for me, when I had my son, I had postpartum and it like rocked my world, but no one was like, hey, heads up, this might happen.
Yeah.
So, and it's because I don't know how to say this. I think a lot of people, when they want something desperately, like you were saying, they will do anything. Yeah. But you don't always think about the consequence of what that might be or how you get there or like the trauma from it. I think
that's with anything. Yeah. I think that's a very good point. Like that's not just with fertility. That's with anybody in life. Like, we've talked about plastic surgery on my face. And I mean, that's not without its risks. But I'm like, we'll get whatever we got to do to get there.
Yeah. But I mean, you have to
and how are you going to be on the other side of it?
Right. You have to think past that and what it's going to be like. And how is that going to be like, if it is hard on your marriage and your relationships, either with your spouse or your family or your friends.
Where does it stop?
What does that look like afterwards? So
but that's a good point. Like, because we talked about financial. And I do not know anything about fertility issues, so please take this with a grain of salt. How do we know that some of these clinics aren't out here just to get money and fail your stuff? Let's not grow your sperm and egg together. Let's fail it so that they have to come back. Let's fail it so they have to come back for money. And I'm not saying that's what's going on, but also in the oncology world, we all know that people are put on chemo when they don't need to be. When they're 90-something years old, stage 4 lung cancer, why are we putting a fucking person on chemo? Because it's a money-driven thing. And I'm not saying that's what's happening to either one of y'all or what's happening in the world, but how do we know?
This kind of relates to that-ish, maybe. I did not know this till after we had our 3 rounds of failed IVFs. There is a website where it's the SART data, correct? Yep. Okay. So any fertility clinic in the U.S. should be on that website, and you can look at all their success, their percentages compared to other people's success.
Good to know.
Yeah.
So anyone who is seeking fertility treatments, please go on that website.
Do you know the website by any chance? We can look it up.
Yeah, we'll have to look it up. It's like, it might be like sart.gov or something. But
it'll be in the show notes. We'll link it in the show notes.
It's like statistical data over years on clinic success rates. If I had seen that at the beginning, I would have started somewhere else.
Okay. Good to know.
I just think the more information you have to advocate for yourself. Like we're saying, people do not want to do different things. They a lot of times are set in their ways with how they want to treat you. Everyone's not the same patient.
And here's the thing, like you're already spending a lot of money, right?
Yeah.
So you don't have to go local. I mean, I know it's inconvenient to go somewhere else, but if it's already
a lot of money either way.
Let's just pretend it's $20,000 in your local area, but $30,000 somewhere else. What's $10,000 when you're already spending $20,000? In my opinion.
That's what I've been asked about actually, because like I mentioned, our new doctor's in Colorado. I don't mind saying the clinic. They're a great clinic. It's the Colorado Center for Reproductive Medicine. So it's CCRM, and the location I go to is in Lone Tree. It's their original location, but there's like probably 10 other offices. Their success data on the SART website is significantly higher than most other clinics. I was supposed to have my egg retrieval back at the end of January, and they canceled me the day before I was supposed to go out there. That was devastating at the time, but my numbers weren't looking right. And he was like, we will not get the best outcome for you if we do this right now.
So they didn't take your money.
No.
So that was a good
So
thing.
it made me trust him even more.
That's
He
a
could
good
have
thing.
he could
He
have
could have said, sure, come on.
and
let's
then
go.
he could have said, I had 17 follicles on my baseline, which means, I should have gotten a good amount of embryos. But if he would have tried to stop my own body ovulating because I was overstimulated, our embryo quality would have been very poor. But he could have taken that money, and then I could have had to pay him $20,000 again. But I mean, luckily I feel like I'm now with someone I trust. And I think that's important too. Every patient's not going to get along with every provider. And if you don't feel comfortable with who's treating you, you're not going to trust them. So if that's an issue for you as well, I would continue to find another doctor.
Well, I think if you're not in like the medical field,
it's hard.
You don't know. Mm-hmm. You just think this is someone that I'm supposed to trust. They're going to give me the best information. Like they would never like steer me wrong.
Yeah.
But then you hear stuff and you're just like, what?
Well, like my aunt said, with anything, doctors, therapists, whatever, there's always an interviewing period, and they should give you one for free. Mm-hmm. She said, you're interviewing them to take care of you. It's not the other way around.
Yeah. Mm-hmm.
So always keep that in mind. Like if you, like Amanda said, you will have that intuition, like, this is my person. I trust them versus someone else. Mm-hmm. I'm assuming you felt some kind of way about your other clinic that made you be like, my intuition is telling me to go elsewhere.
Yeah. After our third failed with literally no answer to why nothing was working, I was like, I've got to go get some more opinions. At that point, I went to my OBGYN, basically just like in tears. What do I do at this point? And she helped me find this other clinic and like recommended some other clinics. And then I did look at that data, and you can go off that too somewhat.
Well, I love what y'all are doing, and I love that y'all are putting stuff out there recently for other people, because I mean, someone who doesn't know, they just don't know, like, this is, I don't know.
I appreciate that too.
Yeah.
Like, so if there's any piece of advice before we end, what would be your number one advice to give someone who's newly on their journey?
I would say definitely advocate for yourself and take care of yourself. And I know that's so vague, but it's so important to make sure you are mentally okay. And, talking to a therapist, talking to someone, there's nothing wrong with that. It's healthy, and just advocate for yourself.
Okay.
Kind of the same thing she just said. I definitely think a second opinion and advocating for yourself is very important. And back to the timeline thing, I felt behind my timeline now for 2 years. Most of my friends who have kids are their second kids now. That's something we all have to come to terms with, whether it's with fertility or your job or you're getting married or whatever. Everyone at some point in their life will not meet their expected timeline. So I've been trying to get better at this, but you definitely have to try to not think about it like that, even though it's easier said than done, because I still haven't done it. But
no, I get what
if
you're
you
saying.
can throw that timeline away, that'll take a lot of pressure off of you.
And thank you so much, both of you, for sharing this journey. I know it wasn't easy. I know that's hard questions to be asked when someone's asking you straight on about children, because as we talked about earlier, and I think my advice to everyone, whoever's listening, to encourage other people to change their verbiage when they're asking people about their children. Just say, like Lauren said, just say, do you want children? And then it's up to the person answering to share their journey if they want to. Don't ask when, say, do you? Because there's also people who don't want children, and when you continue to ask them when, they feel like something's wrong with them because they don't want children. Mm-hmm. So I truly thank y'all both again for doing this. Also, share your group, pimp yourselves out real quick. Where can everyone find the fertility group?
Yeah, it's on Instagram. So Infertility Support Huntsville. You'll find us there, and we'll update more events coming up. We're going to try to do monthly.
Yeah, we'll have one in March, probably the end of March.
Mm-hmm. And if this reaches out, because I know this reaches out past Huntsville, maybe do a virtual
absolutely
meeting setting so that they can't come to Huntsville. We can do a Zoom for them.
Yeah, absolutely.
All right, guys. Thank you so much again.
Thanks for having
us. Yeah, thank you.
Bye.
Bye.